Namaste everyone, welcome back to my channel Physio Vitals. I am Dr. Ankita Sawant and I am back with the topic on pneumonia. So hope you are doing well. So today we will be discussing pneumonia, a serious condition that affects the lungs and the respiratory system. So it can be life-threatening, especially in vulnerable populations. So our discussion will cover its anatomy, physiology, pathophysiology, its symptoms, investigations, what examinations we are going to do, treatment, and very important part of this lecture is what will be the role of physiotherapy in managing the pneumonia. So pneumonia is a common respiratory infection impacting millions annually. This presentation will delve into its intricacies, exploring the anatomy, physiology, and mechanisms of this complex condition. So first we'll focus on the anatomy. So the lungs are the primary organs which are involved in respiration, which are located within the thoracic cavities. Right and left lungs, we have two lungs. So and are divided into two main sections, right and left, which I just mentioned. So the right lung has three lobes, the superior, middle and the inferior lobes. The left lung has two lobes, which is the superior and the inferior. Now we have two fissures on the right lung and one on the left. The horizontal and oblique fissure lies on the right lung, divides the three lobes. Whereas on the left lung we have one oblique fissure and lingular and cardiac notch, because it gives a space which is occupied by the heart. That's the reason left lung is shorter as compared to the right lung. So the lungs are connected to the trachea via the bronchi. The bronchi further divide into smaller branches known as bronchioles, which end in tiny air sacs which are called as alveoli. So it is the alveoli where the oxygen and carbon dioxide exchange occurs. It's a process which is essential for breathing and gas exchange. So respiratory tract, we'll see. The air enters the body through the nose and mouth, travels down the trachea and branches into bronchi. The bronchi further divide into bronchioles, leading to tiny air sacs called alveoli where the gas exchange occurs. The gas exchange. Oxygen from the inhaled air diffuses across the thin walls of the alveoli into the blood, while carbon dioxide diffuses from the blood into the alveoli to be exhaled. So anatomy and physiology of the respiratory system, very much important. Moving further to the physiology, the main function of the lung is the gas exchange, where the oxygen is inhaled into the alveoli where it passes into the blood, and carbon dioxide is expelled from the blood streams into the alveoli to be exhaled. This process is driven by the respiratory muscles, particularly the diaphragm and intercostal muscles, which help in ventilation, breathing in and out. So if you know the respiratory muscles, comment down in the section, I will revert it. So under normal circumstances, the airways are sterile and the lungs are protected from pathogens by the mucosal defenses. Cilia that traps the foreign particles. There's a ciliar layer, hair-like projections, which traps the foreign particles and the immune system. Okay. So however, when this defense is compromised, the defense system we just saw, the mucosal defense, cilia and the immune system, if these defense is compromised, pathogens like bacteria, viruses or fungi can cause infection. Moving further now to the pathophysiology of the pneumonia. So pneumonia is an infection of the lungs parenchyma, typically caused by bacteria, viral or fungal agents. These pathogens enter the lung and multiply, leading to inflammation in the alveoli. The immune response to this infection causes edema, with the fluid buildup in the alveoli, impairing the gas exchange. If the alveoli are edemous, like if the fluid is built up in the alveoli, it will impair the gas exchange. Whereas on the other hand, if there is inflammatory cells which are infiltrating the lung tissues, causes the further damage to the lungs. The alveolar wall thickens, making it harder for oxygen to diffuse into the bloodstreams. In bacterial pneumonia, the body responds with fever, increased heart rate, and a build-up of pus in the lungs. So in bacterial pneumonia, what all symptoms we see? Fever, increased heart rate, and build-up of the pus in the lungs. In viral pneumonia, inflammation is more widespread and the symptoms tend to be more generalized. So infection, as I said, bacterial, viral or fungi, which invade the alveoli, triggering the inflammation and fluid accumulation takes place. Alveolar compromisation, the fluid which builds up hampers the gas exchange, leads to reduced oxygen levels in the blood. Again, the immune response, body's immune system fights the infection, but the inflammatory response can damage the lungs tissue. Okay, now very important part, we'll see the symptoms and the clinical presentation. So common symptoms of pneumonia include cough, often a productive cough or the mucus, okay, then fever and chills. So in cough, a persistent cough, sometimes producing phlegm, fever, which elevated body temperature, indicating the body's fight against infection. Then we see shortness of breath or difficulty breathing, which is the feeling which is usually the breathlessness feeling or needing to take frequent breaths. Chest pain or the discomfort in the chest area often worsens with the breathing. Okay, so fatigue and malaise, increased heart rate, which is also known as tachycardia in medical terms. Confusion, particularly in older adults. So cough, fever, shortness of breath, chest pain, fatigue, increased heart rate, confusion. So these are some symptoms which vary depending on the severity of the pneumonia and the pathogen which is responsible for this infection. Now, how to diagnose pneumonia? To diagnose pneumonia, a combination of clinical examinations and diagnostic tests is necessary. First, physical examination, inspection and palpation of the chest for abnormal movement. Percussion to assess for areas of dullness, which can indicate fluid accumulation. So first, in physical examination, we'll see inspection and palpation of the chest for abnormal movements, then percussion to note the dullness, which indicates the fluid accumulation. Then auscultation, listening the lung sounds for crackles or decreased breath sounds indicating the infection. Next, imaging, chest X-ray, the most common diagnostic tool showing infiltrates or consolidation of the lungs. So, X-ray imaging of the lung, which identifies the area of the inflammation and the fluid buildup. Next, CT scan, if required, may be used in more complicated cases. Okay, laboratory tests, which is a blood test which evaluates white blood cell count and other indicators of infection. So, blood test basically to check the elevated WBCs and signs of infection. Then, sputum culture to identify the specific pathogen causing the infection. Then, pulse oximeter to measure the oxygen saturation in the blood. Nowadays, we all have the smartwatches, so we can rely on that also. Microbiological tests, blood culture to detect bacteria in the bloodstream. Urinary antigen tests for specific pathogens like Streptococcus pneumoniae or Legionella. So, moving further now to the examination. I'm focusing more on examination as during the clinical examination, the healthcare provider will focus on the vitals, elevated heart rate, fever, low oxygen saturation. Chest examination, as I said, inspect for the labored breathing and use of accessory muscles is there or not. We need to observe that. Auscultatory findings, rackles, wheezing, absent breath sounds that may indicate consolidation or pleural effusion. So physical examination will often prompt further investigations such as imaging and microbiological tests to confirm the diagnosis. So we'll focus now the pharmacological treatment. The treatment of the pneumonia depends on the underlying cause, bacterial, viral or fungal, and the patient's overall health condition as well. So the general approach I am going to discuss is antibiotics for bacterial pneumonia, penicillin, microlides, cephalosporins, fluoroquinolones are commonly prescribed depending on the bacterial strains. Antiviral infection for viral pneumonias, oseltamivir or influenza. For influenza, oseltamivir for influenza and other antiviral agents for specific viruses. So supportive care. So oxygen therapy to maintain oxygen level, fluid to prevent dehydration and helps with mucus clearance. Analgesics for chest pain and fever. Then hospitalization if required. Like some patients may need hospital care, particularly if they have several pneumonia or underlying health conditions. In severe cases, mechanical ventilation may be required. Antibiotics according to the virus, bacteria, viral or fungal will do that, inculcate the medications, oxygen therapy and hospitalization if required. Now, very important part of this lecture is what will be the role of you as a physiotherapist. If you are a physiotherapist, what will you do when you get a patient or a case of pneumonia? So physiotherapy plays a crucial role in management of pneumonia, especially in helping patients with recovery, improving lung function and preventing complications. So first is breathing exercise. Diaphragmatic breathing and pursed-lip breathing can help improve the oxygen intake and prevent airway collapse. So airways should never be collapsed. In order to encounter the collapse, diaphragmatic breathing and pursed-lip breathing must be prescribed. Then postural drainage. According to the physiotherapist's examination, the auscultatory findings, you should identify the positions, area of which are affected, which are increase in ventilation. According to your auscultatory findings, you should be doing the correct postural drainage positions. So physiotherapists use the gravity assisted positions to help mobilize mucus from the lungs, especially in patients with thick secretions. Then chest PT, chest physiotherapy. Techniques such as percussion, vibration and shaking can assist in loosening the cough. Then encouraging mobility. Early mobilization and light exercise can help prevent complications like deep vein thrombosis and improve lung function. Endurance. Education. Physiotherapists educate patients on maintaining good posture, avoiding smoking and using inhalers or other treatments correctly. So in severe cases, physiotherapists help with weaning off mechanical ventilations and improving respiratory muscle strength. So we also deal with patients who are on ventilators. So chest PT is really important. If you give a correct and accurate chest PT, you can wean off the patient from ventilation and improve its respiratory muscle strength as well. So in conclusion, pneumonia remains a significant health concern globally, but with timely diagnosis, appropriate treatment and supportive care, many patients recover successfully. So physiotherapy enhances recovery by improving respiratory function and preventing complication. Thank you for your attention throughout this presentation. Pneumonia, though serious, can be managed. Though it is the serious condition, but it can be managed effectively with proper medical and physiotherapeutic interventions. So I hope this discussion has provided valuable insights into the anatomy, physiology and pathophysiology and treatment of the pneumonia. Should you have any questions or require further information, feel free to ask. Stay healthy and take care. God bless you all. Thank you.